I'd also like to welcome Professor Keith Lloyd. Professor Lloyd is the Dean of the Medical School at Swansea and a working psychiatrist in South Wales. And Professor Lloyd would like to add his congratulations. Thank you, Keith.
Shemai, hello. Indeed, I would. And what I'd like to say to our graduates is that you have graduated into a profession that has faced many challenges over many centuries. Every time that's happened, through the application of both the science and the art of medicine, you, we, and our predecessors have always risen to those challenges, just as we will with this. In recent weeks, we've seen the power of science through evidence-based medicine harnessed at a global level to begin to understand and treat coronavirus more effectively. New treatments, repurposed treatments, a better understanding of the complications and how to manage them. The case fatality rates of people in hospital with COVID-19 in the UK is going down. There are many possible explanations for that. Here in your medical school, researchers are at the forefront of UK routine health data analysis. The Sale Data Bank is advising both the Welsh and UK governments on coronavirus. There's still an awful lot to learn. Why, for example, are some ethnic minorities particularly at risk from coronavirus? Now that, together with Black Lives Matter, means that we still have to do much about injustice and inequalities. And an understanding of that is also vital to the practice of medicine, as I know you all know. As a medical student some time ago, I remember a ward round in the medical ICU. We saw a ventilated air steward who had a baffling new condition. Previously fit and healthy, he now had pneumocystis pneumonia and Kaposi sarcoma. Later that year, the Centre for Disease Control in Atlanta named this illness acquired immune deficiency syndrome, AIDS. The reason I'm telling you this is because at first, HIV seemed like a death sentence. And as you know, that has changed thanks to the science and art of medicine, to evidence-based medicine and social change. As a result of all that, people with HIV can now have normal life expectancies where they have fair and safe access to treatment. There's even talk of a cure. And I think the same will happen with coronavirus. In fact, I'm confident of that. You will have a big role to play in that with help and support from the rest of us. So the oath you'll be taking a bit later on today emphasizes both the science and the art of medicine. That's why. So stay safe and remember that, as the Vice-Chancellor said, we are a strong community here, and if we help each other, there's so much to be gained from that. You have your community here in Swansea, and you're now already part of a global community of physicians. Like your families and friends, we are immensely, enormously proud of you. So the world needs bright minds like yours. So stay hopeful, stay in touch, enjoy the rest of today. Warmest congratulations. Llongyfarchiadau, and thank you. Diolch.
Thank you, Keith. That was wonderful.